Welcome to our Insight series on organizational well-being. Our question for this week is, Wellness Big 10, what are the main program intervention options for improving heart health? Number 22. In describing the main program intervention options for improving heart health that can be used in an employee wellness program, we're going to be giving you some suggestions and some possibilities that are based on the precept that the further down the list, the more costly the intervention is, the more difficult it is to implement, and yet more effective that it is in helping change long-term behavior of employees and their spouses and family members. Now, to begin with, we can provide articles, guides, handouts, podcasts, and other videos that deal with the prevention of heart disease. So that's our initial offering, our initial possibility. Secondly, we can distribute to employees educational materials on the prevention of heart disease. There are a number of them, a number of different entities that provide those. One of them is the American Institute of Preventive Medicine. We can encourage employees and spouses to see their PCP, their primary care practitioner, to examine their risk of heart disease and stroke. And fourth, we can conduct periodic standalone cholesterol testing that gives us the fractionations, the lipid fractionation for cholesterol levels. We can provide a smartphone app that helps employees and spouses work on heart disease prevention issues. We can conduct periodic standalone blood pressure testing or carry out a blood pressure sweep where we have people who can do blood pressure actually go into the work site and move from workstation to workstation, asking people if they want to have their blood pressure measured. We can also provide a lunch and learn session on heart disease prevention using an outside presenter. We can provide a health risk assessment or a questionnaire that includes questions and recommendations about heart health. We can require that each employee have a primary care practitioner and encourage them to stay current with their preventive care requirements. We can also bundle the HRA, cholesterol test, and blood pressure measurement into a wellness assessment. We can also do the same thing and then provide a significant incentive for its completion and for meeting any goals that they may have each year related to cholesterol levels, blood pressure, and/or scores, overall wellness scores on a health risk assessment. We can also provide an opportunity for a healthcare professional to counsel each employee completing the preventive screening. We can introduce a new $600 to $1,800 a year health plan premium contribution requirement. That's up $50 to $100 to $150 per month for the health plan premium contribution level for all employees, and it can also be applied to spouses so that it can be waived for meeting a minimum number of wellness criteria. Those wellness criteria can include such things as the completion of the wellness assessment. This uses employee dollars, not employer dollars. So that's what allows us not to include it in a return on investment analysis of our wellness program. We can also consider using one or more wellness criteria connected to various heart health issues, including cholesterol levels, blood pressure, body weight, physical activity levels, non-tobacco user status, and completion of preventive screening. Another option, an alternative that is more costly, more difficult to do, but also more effective, is to provide an e-health portal with a strong heart disease prevention component. We can also consider a wellness criteria connected to a lower premium contribution level, such as the $600 to $1,800 per year, that requires that each employee and/or spouse be fully current with all preventive screening requirements according to the United States Preventive Services Task Force recommendations. And we can also require completion of one or more learning management system modules. They're usually provided by a learning management system vendor on heart health issues and prevention of heart disease. And those issues can be connected to a wellness criteria for completion of the modules and passing the tests associated with each module. And the waiver of the $600 to $1,800 a year of health plan premium contribution can be used as the incentive dimension for such an approach. And finally, we can provide wellness coaches to work with employees and spouses that want to reduce their risk of heart disease for up to an 18-month period. It's recommended also that you do it for 6 months at a time, but you have the ability to go longer than 6 months by having another 6-month period used by the individual. So in summary, there are many ways to improve the heart health of employees and their spouses. Each of these intervention options have their own pattern of direct cost, difficulty, and effectiveness. It's also a good idea to consider addressing all the major heart disease risk factors in some aspect of your employee wellness program. Now, for more information on this topic, try putting the following search strings into your web browser: heart disease prevention in the workplace, healthy heart programs, heart health for working populations. Next week, we will address the question, Wellness Big Ten, what are the main program intervention options for helping employees manage their weight? For more information, please feel free to visit our website at www.chapmaninstitute.com.